My name is Dr. James Chon. I practice at Inline Dentistry in Diamond Bar, and I'm a big Eagles fan, Philadelphia Eagles. I used to live in Pennsylvania when I was in middle school. I've been a big fan ever since then. The last patient on that trip, it was a 4 days of seeing patients, but the last patient was the most important. She must have been 13, and she had a large gap between her front two teeth, and her lip was very tight. She did not want anyone to see it. Before I went on that trip, I didn't really know what dentists could do. I only had cleanings before, so I thought all he did was cleanings. The dentist, he was, must have been his late 60s at the time. He said, "We're going to make you beautiful." At first, I thought that was overpromising. I thought that was a little too much. And then he ended up placing some fillings there because that's all we had at the time. But he placed like this filling. He closed the gap in her front teeth, and I remember the look on her face when she saw it. It's like a feeling I've been chasing, kind of being able to do that for someone. And it's kind of funny. So we ended up going back 2 years later to Guatemala. I was looking for that girl. I didn't see her until actually like near the end of the that trip too, and she looked so different. She was very confident. She had a handsome boyfriend. I got to see the effect of that on a person's life, and I realized that dentistry can be an awesome profession. So for me, when a new patient walks through the door, I want them to feel comfortable. That's the most important word. They have to feel comfortable while we just talk to them and explain the state of their mouth and the different options, and they have to feel comfortable when we begin doing any work. So for me, that's the most important part because the dental office can be a very scary place, and also it can feel like a place where you're just a number, you're just another person on the schedule. But we try to make you feel comfortable and make sure that you feel like you're not just a number, but you're a patient that we're trying to take care of. In line is mentally the patient and I have to be on the same page. So that means that they understand why we're doing a treatment, the different options they have, and then what I recommend versus what may not be ideal. So we have to be on the same page because a lot of patients, when they come in there, they explain that their experience at the last dental office was they're confused. So that has to be the number one thing is mentally we have to be on the same page. That is the most important part at the beginning. The cosmetic side or just the visual side, a lot of people aren't happy with their teeth. They feel like they're not, and they're crooked or they're chipped. There's many different negative words that people use to describe their teeth, and I think it has a little more meaning than just simply just having like a beautiful smile. It's just things are nice and orderly. Right from the jump, I really emphasize to the front desk that the important part is just like a welcoming phone call. That sounds so simple and it sounds obvious, but it's not always the case. If I call somewhere, they have very negative impression just on the phone. So that's something that my office manager Isabel is very good at, and it's something very important to me. And when they come in, we try to answer all the questions they have. There are so many questions, and then more than just answering their questions, we try to draw out the questions that they actually really have. A lot of times, embarrassed to ask, or in the back of their mind, they kind of feel like we have ulterior motives or something. But we try to draw that out so that patients feel like they're understood and they're known, and we're on the same page. And I guess you could say we're in line with each other. If I had to think of one thing that I want patients to know, it's you can trust us. So that is the most important thing, and it's a really hard thing to earn, and it's a really easy thing to lose. So my goal is from all the steps in from the phone call to the exam, from how we talk to you, and from when we do the work and after the work. If we can get the patient's trust, I feel like we have succeeded. That also includes one of the things we do is we have a 4 year warranty on any work. A lot of offices, they're not really vocal about the warranty, or maybe 1 year at the most. We've taken care of under warranty just to make sure that the patient knows that we're not trying to nickel and dime them, but we want to make sure that they can depend on and I want to do the best for the patient. The 4-year warranty is if anything breaks that is from a reason that is not necessarily the patient's fault, we'll take care of it. So what that means is they have a filling that breaks. We're not going to charge the patient again. They don't have to be super worried about that. We'll take care of it. Perhaps maybe like if a crown, like in the back tooth, broke off, we'll take care of it. So I think a lot of times patients they may not feel comfortable with the work that's done, or not sure if it was something that was done with the recommended with the best intention. We stand by the work, and we want to make sure that the patient has a peace of mind with it.